Today we are discussing scapula, that is the second bone in the upper limb. If we discuss the bony features, there are two surfaces, the anterior or the costal surface, the posterior or the dorsal surface. There are three borders. This one is the superior border, this one is the medial border, and this one is the lateral border. And there are three angles. This is the superior angle, inferior angle, and lateral angle. There are three processes, spinous process, Acromion process, and this finger like is your Coracoid process. We see the side determination points. This is the superior border is small and it lodges a suprascapular notch. The lateral border is the most thickest and it has a glenoid cavity, and there is a medial border. The anterior and posterior surface is differentiated by the spinous process and Acromion process, which is always posteriorly. So this bone is of the left side. Now features, this is the costal surface or the anterior surface. It has three costal ridges. Okay, and this is known as the subscapularis fossa because subscapularis muscle attaches here. If we see the posterior surface or the dorsal surface, it has an Acromion process, a spinous process, and the spinous process divides this surface into the supraspinatus fossa, and this one is the infraspinatus fossa. Infraspinatus muscle attaches here in the infraspinatus fossa, and supraspinatus muscle attaches here in the supraspinatus fossa. If we see the borders, there is the short superior border which lodges a suprasternal notch and suprascapular notch, and this is the coracoid process that is in the superior border. If we see the lateral border is the most thickest one and it lodges the glenoid cavity which makes a joint, shoulder joint with the head of the humerus, and the medial border is the thinnest one. Now if we discuss the processes, this is the spinous process and the posterior border of the spinous process is also known as the crust of the spine. This has an upper lip, this one, and a lower lip. This is continuous with the Acromion process. This is the Acromion process. It has a superior surface and a inferior surface and a anterior border and a medial or the anterior border and the posterior or the lateral border. Coracoid process is a finger-like, and coracoid stands for the crow's beak. So it is beak-like or finger-like projection, coracoid process. If we see the muscle attachment, the muscle attached in the supraspinatus fossa is the subscapularis fossa is the subscapularis, and in the medial border on the costal surface there are 8 digitations of seratus anterior. First and second digitation is attached here, then the third digitation, and 4 to 8 digitation is attached here. This muscle there is the lathismus dorsi. And if we discuss the dorsal surface, the upper lip of the spinous process gives attachment to the trapezius, which goes here to the medial border of the Acromion process, and deltoid is attached to the lateral border of the Acromion process and the lower lip of the spinous process. Infraspinatus muscle, supraspinatus muscle, and on the medial border there is levator scapulae, rhomboid minor, rhomboid major. On the lateral border, teres minor, teres major. Some muscles originate from here, from the supraglenoid tubercle. The bicep, long head of bicep originates, and coracobrachialis and short head of bicep originates from the medial surface of the coracoid process. And from the infraglenoid tubercle, tricep muscle originates. Seratus anterior is attached to the medial border of the costal surface, and if the paralysis of the seratus anterior muscle takes place, the medial border is unduly prominent and scapula is like this. This deformity is known as winging of scapula when the medial border of the scapula becomes unduly prominent due to the paralysis of the seratus anterior. and the seratus interior is supplied by the long thoracic nerve from the brachial plexus that is injured.